Good afternoon. We are going to get started. My name is Vicki Sharpe, and I'd like to welcome all of you to the second annual Dan William Award for Medical Excellence. Before I went to medical school, I worked for an obstetrician gynecologist, and I hate to tell you how many years ago, but it was a long time. And once a week on Wednesday afternoon, he wasn't in the office, because he was volunteering at Planned Parenthood. Those kinds of doctors went away. They disappeared in the 70s and the 80s, and I thought they were really extinct until I came here in 1997, and I met Dr. Dan William, who was volunteering his time at the Samuels Clinic. He'd been doing that for years and continued to do it for years. And today we are here to honor his memory with this award, which was created last year through the efforts of Dan's partner, Robert Friedman, who's here. And we're delighted to host the second annual award. So with no further ado, I'm going to turn it over to Robert for a few words.
Thank you, and again, I want to thank Dr. Sharpe and her assistant Bobby Argabright, who's in the back, for all of the work that you've done to get this luncheon going and all the coordination, so thank you very much. And again, I'm just thrilled to be here for this second annual presentation of the Dr. Dan William Award for Medical Excellence, which is given to an outstanding young physician who's completing training. And it serves as a reminder of Dan's medical career, his dedication to his patients, his love of teaching, and the work he did as a volunteer in the community. Dan began his career in 1972 with a strong interest in epidemiology and sexually transmitted diseases, especially those prevalent in the gay community. He helped organize and manage the Gay Men's Health Project, which was an all-volunteer screening facility for syphilis and gonorrhea, and later in conjunction with the New York Blood Center, participating in studies that led to the approval of the first vaccination against hepatitis B. The HIV/AIDS epidemic was the greatest challenge of Dan's career. It started slowly and insidiously, gradually gathering steam, with more and more people becoming aware that there was some sort of a problem, some new kind of illness, hard to describe, difficult to quantify, impossible to predict, and hopeless to treat. Dan worked with many fine and dedicated physicians, some of whom are here with us today, with the CDC and the New York City Department of Health, and with medical colleagues from all over the country to understand what was happening, find the cause, to prevent and to treat those who became ill. He tirelessly volunteered his time to explain what was known about this new syndrome and to ensure that his many patients who were infected with what was later understood to be a virus got the best care available. Dan was diagnosed with polycythemia vera, a myeloproliferative disorder, in 1981, eerily coinciding with the start of the HIV epidemic. And I think that this reminder of his own mortality gave him a particular insight and empathy with his patients. In spite of his own illness, he continued his private practice, his work in the community, and his Wednesday afternoons where he worked as a volunteer physician at the Samuels Clinic here at Roosevelt. When Dan's health deteriorated to the point where he was forced to retire from medical practice in 2002, he continued to be active in the community, and again, as a volunteer, to teach interns, residents, and second and third year medical students rotating through Roosevelt. He continued teaching, which he loved, until just a few weeks before his death in 2008. So this award today allows Dan to continue to teach and to inspire. And one of the physicians that I mentioned earlier, one of the colleagues that Dan worked with and knew Dan, is Dr. Abby Zuger, a graduate of Harvard College and Case Western Reserve Medical School. She trained at Bellevue and later completed fellowships in internal medicine and medical ethics. For many years, she has worked predominantly in AIDS medicine, formerly in the AIDS Clinical Trials Unit at NYU and at the Montefiore AIDS Clinic, and currently at the AIDS Clinic at Roosevelt. She is also a medical writer and author in 1995 of Strong Shadows, a book about AIDS, and she has published articles on health and health policy in the New England Journal of Medicine, Health Affairs, and, where I read her most, in the health and science pages of the New York Times. Dr. Zuger.
Hi, everybody. Thank you, Bob. It's a real pleasure for me to be asked to say a few words about Dan, even though I think I've been asked because I am one of the fossils, alas, in our clinic who remembers him so well. There are only a few of us left, unfortunately. I didn't know Dan all that well, but I certainly knew him well enough to know what a very, very nice guy he was and what a very, very good doctor. And also, I remember most notably what extraordinary enthusiasm he brought to working in our clinic. And for that big smile alone, he tended to stand out from the Wednesday afternoon crowd, of which I've been a member for an awfully long time. So what I wanted to talk about, and this is a talk that goes on for probably about 9 minutes, no more, is the last time I saw Dan. This was not a particularly dramatic situation. It was probably a year or so before he died. It was a Friday in the early afternoon, a very, very pretty spring day, in front of the elevators on the second floor. As you may or may not know, our clinic is on the second floor, right actually down the hall there, so this is our elevator bank. So I was finishing a Friday morning clinic session that had run way over time, and I was heading out. I was waiting for the down elevator. Dan, in his white coat, was heading up to the wards. He was gearing up to meet a crew of Columbia medical students for a Friday afternoon physical diagnosis session. And for those of you who don't know, this is usually the first immersion of first-year medical students into the hospital, and it requires a lot of work from the preceptor. Preceptor has to be very careful in selecting just the right patient to meet a group of generally completely uneducated students so that nobody gets upset. Not the students, not the patient. Everybody has a reasonable time. And so there was Dan. It was a Friday afternoon in the spring, beautiful sunshine outside. He's probably already put in several hours of work upstairs. He's waiting for the up elevator on the second floor. He's cheerful, as always. He had a big smile on his face. So that's what I'm going to talk about now for a couple of minutes, is this image of a sick man. He's getting older. He's taking that up elevator. He's going up to everything that lives up on the wards, to the students, to the patients, to the house staff, to all of hands-on medicine. There is a tendency in medicine, as with many occupations and professions, for age and experience to influence behavior in a somewhat counterintuitive way. You might think that for doctors, for teachers, for professors, for nurses, for people in almost any job with a direct public interface, you might think that as people age and become expert in what they do, they get good at the clinical encounter, at the pedagogical moment, you might think that as they age, they would increase the time they spend in direct contact with their target human being, the patient, the student, or the client. But of course, you would be thinking incorrectly, because the general traffic is usually in exactly the other direction. Routinely, research and administration lure the older, more experienced professionals away. There are, of course, exceptions, but generally the hands-on jobs are left for the young. And so teachers get older and they become principals rather than teachers. Professors stop teaching undergraduates and they do their own research and publish scholarly articles. Journalists take off their shoes and become editors rather than reporters. And academic doctors become administrators and joyfully give up much of their ward time. Many of us never duplicate the density of clinical encounters we had during training. The prestige, the money, the professional status all seem to pull us away from the primary mission of whatever the enterprise is. The old plan, but it's usually the young who execute. So why should that be? I've never really understood that. It's a big question, and there are a lot of sort of subsidiary chicken and egg type questions involved. So look at medicine and think about it. Do prestige and high salary accompany non-clinical work because this kind of work is necessarily more difficult and more valuable? Well, that's certainly possible. Or the other way around, has it worked out that way because older people naturally gravitate to non-clinical work and then they pay and honor themselves commensurately? That's possible too. I don't know. But whatever, at least just looking at the little microcosm of ward medicine, it's actually easy to identify several processes at work that may keep older folks from taking that up elevator quite as often as they did when they were young. And here are three of them. First of all, it turns out that older doctors think very differently. Age changes the way you approach patients even before you become completely senile. And I was amazed to discover how much research there is into this question. There is a gigantic body of literature out there, and a lot of it comes from the programs that pretty much every state has for identifying substandard doctors, figuring out what their problems is, and attempting to remediate them. And as all these programs have been in existence, they've accumulated a lot of data that people are out there analyzing. So this is carefully validated. It's using a lot of computer simulation and simulated patients and chart reviews. And the gist of all these articles, the results are that older doctors are good at one thing. They are better diagnosticians than younger ones, mostly because they have pretty finely honed instincts. So the first time they see a sick patient, they can get to the problem better than the younger ones can, but otherwise, terrible. Their memory is worse. Their ability to assimilate new information, much worse. Their ability to change course, and when the first hypothesis proves to be wrong, to assimilate new data and come up with other hypotheses, terrible. They can't reason from incoming data at all. And it turns out that in all these studies, age is a strong, independent predictor of poor overall competence when doctors are evaluated. So that's one reason that older doctors may not take that up elevator quite as often as they used to. And then, of course, there are other reasons, which we all, I think, are probably familiar with. First of all, I know this from personal experience, the milieu upstairs, once you get off that elevator, becomes slowly unrecognizable. Every year, the atmosphere is both all too familiar and completely unfamiliar. The patients don't change, that's the familiar part. But the sociology of the whole enterprise changes. Everything changes. The pace, the expectations, the reflexes that are accepted, they're all just a little different than they were last year and almost unrecognizable from what they were 30 or 40 years ago. What you learned to do a long time ago and what you're supposed to do now are increasingly out of step. So that's number two. And number three, it's a big world out there in the other direction from the up elevator, and that's down the down elevator and out the door of the hospital. You get older and time gets shorter. Instead of being on 9B, you could be in Madrid. You could be watching whales. You could be drinking in Venice. The scenery from the rooms on 9B, as I happen to know, you see some gardens in the condo across the street, and that's no comparison, really, to what else is out in the world. So let's go back to Dan. He's in his white coat on a beautiful spring afternoon. He's waiting for the up elevator on the second floor. He's not old, really. I don't think he's old, but he's getting older. He has every statistically validated reason to be losing enthusiasm for clinical work. He naturally thinks a little bit differently than he used to. The knowledge base he needs is changing quickly, and the climate upstairs is changing as well. Dan knows he has a fatal disease, and he knows his time is running out. He could be in Paris. Instead, he's headed with a smile on his face up to 9B to shepherd a bunch of kids in brand new white coats through their first clinical encounter. So this is a picture deserving of our admiration and our respect, and it's worth our remembering every year as something that the rest of us might aspire to. So join me, please. Lift a glass. Here's a toast to Dan, the good doctor who took the elevator up. Thank you.
Thank you, Abby, for some very inspiring words. We have a little change in our program. Dr. Gabriel Serra, who worked with Dan, has asked me to say a few words. So we're going to get a little informal here, right, Gabe?
Thank you, Vicki, for the time you gave me out of your schedule, and I want to thank you all, especially Bob and the family, to continue that wonderful, wonderful thing they started in memory of Dan. Some of you have known Dan, and he left us 4 years ago, supposedly. I really think he is right here today, very, very present and very alive, because I don't think that people like Dan can just leave without staying with us. Who are the two people who got the awards? I would like to see you. One person. Where is it? Okay, congratulations. And I just need you to know a bit more about Dan. You heard about Dan already. You can hear much more. It will never be enough to know who Dan was. I happen to know Dan since 1984, so I've worked with him for a long, long time. And at that time, when very few of us knew about computers, he knew everything about computers. He was the person who I would learn all the tricks about computers. I'm pretty good today thanks to him at that time. He would have the first Palm, the last software. He would know all the search engine in medicine. Maybe some of you remember Grateful Med, which was the initial search engine when you worked with in the 80s. And so you would think that he was this computer whiz, and he works with computers. What is amazing is that today he would be probably the most knowledgeable guy in computer in this room if he was alive. I'm sure. He will put all of you to shame. He will show you how much he knows how to play with them. At the same time, he was the most amazing clinician I've ever met. He remains a role model for me today, and I think of him a lot when I see my patient. He cared for the patient so much. He would give himself 500%, and he knew everything about his patients, but always discreetly. He will never, you will always know that when a patient of Dan is coming or is referred to you, everything has been prepared for you to do your best for that patient. So the commitment he gave to his patients and the time he spent with them, the time we spent examining them, exploring every single issue. He would see an abnormality. He will not just say, okay, I'll check it out again next time. He will try to understand. He never left a question unanswered, and he always knew what question to ask. So in this day of age where right now we're becoming pushed to see patients quickly, to have a rapid turnover, we have computers that we think make us much smarter. It's important to remember Dan and to remember the kind of clinician he was and the role model we want him to be and to try to imitate. So when you get that award, you're responsible for a very important thing, to be somebody like Dan and to share that with your colleagues and teach it to your students when you will be older in the future. Thank you very much.
Thank you, Dr. Sarah. And now Dr. Jin Su is going to introduce this year's awardee. Jin?
Thank you, Vicky, and thank you, Dr. Sarah. It has certainly been a very busy week. I think in the past week, we've crowned the winner of the Dancing with the Stars. Last night was the American Idol, and not to be undone, today we will find out the winner of the Dan Williams Award for Medical Excellence. There is a slight change in the program. I'm actually here to introduce the introducer. But I also wanted to say that last year's winner, who is Cesar Figueroa, he wanted to be here today, but he's on vacation abroad. He's currently doing an infectious disease fellowship at Memorial Sloan Kettering with a focus on HIV management. And I believe he's in Paris right now. Dr. Williams would be very proud, I believe. So our introducer, she is Dr. Bijal Almeida, who is the Senior Associate Program Director for the Department of Medicine.
Good afternoon, everyone. I'm here to represent the Department of Medicine for Dr. Polsky and also Dr. Fried, who unfortunately couldn't be here today, but who extends his warmest congratulations to you. It is my pleasure to introduce the winner of this year's award, given in honor of Dr. Daniel William. As we heard, a very respected and compassionate physician and a very dedicated and enthusiastic teacher of many, many generations of house staff and medical students. Now I'll tell you a little bit about the winner. Dr. Melissa Lesko joined our internal medicine training program here at St. Luke's Roosevelt in 2009, and she's a member of our graduating class. She completed her undergraduate degree at Villanova University, where she was on the Dean's List and was the recipient of multiple leadership and service awards. She went on to complete her medical education at the Philadelphia College of Osteopathic Medicine, where she also excelled. Melissa is truly one of our outstanding senior residents. She's known to be a great teacher, a confident clinician, a tremendous role model, and I take this directly from her evaluation, a very fine human being. She has handled difficult situations with grace and dignity and is respected by her peers for her intelligence, her clinical acumen, and her absolute approachability in any situation. She is the epitome of both a team player and a team leader. And I'd usually summarize this as she's the type of doctor we would want for ourselves or our loved ones. I'm proud to call Melissa one of our graduates, and I know that her future holds great and wonderful things ahead, and that she'll continue to practice medicine in the manner that Dr. William did so lovingly for his entire life. Please join me in welcoming Dr. Melissa Lesko to the podium.
Hi, good afternoon. To the William family, Mr. Friedman, Dr. Mehta, Dr. Polsky, Dr. Sharpe, Dr. Sarah, Dr. Zuger, all our other faculty, and my colleagues who could come today. I'm very honored to be named as this year's recipient of the Dan William Award. I wanted to pursue a career in medicine, as cliche as it may sound, to help people. And to me, what has always been most important is doing what's best for my patients and advocating for them and their family members. Although I wasn't fortunate enough to have known Dr. Dan William, I'm humbled by his compassion for his patients, his passion for teaching students, and I will strive to live up to his legacy throughout the rest of my career. Thank you very much.
Melissa, congratulations, and here is your award, a couple of bookends, and your name will also go on the plaque that is hanging in the Department of Medicine, so congratulations. What? A picture? Okay, well, I'll just, that completes our program, and I will say that in a time of discussions about healthcare that often leave us thinking that it's nothing but managed care and Affordable Care Act and budgets and volumes. It's nice to hear the comments today. They remind us that, in fact, there is a soul to this profession of ours, exemplified by Dr. Dan William and by many, many, many of the physicians in this room and by this year's awardees. So thank you all, and enjoy the rest of your lunch. Thanks.